The confirmed number of cases here in Alberta has risen by 17 in the last 24 hours to a total of 56. Of the 17 cases, 3 are in Edmonton and 14 in Calgary. Chief Medical Officer Dr. Hinshaw will follow with details on these cases. We believe we have reached an inflection point in the progression of this pandemic in Alberta. For at least some of the new cases over the weekend, public health officials have not confirmed a travel history or close contact with a traveler. This indicates community spread. However, follow-up investigations are continuing. It is very important to emphasize that here in Alberta and around the world, international travel is the key element of transmission. Albertans returning to home from abroad or foreign nationals coming to Alberta are critical. It is critical that they respect the advice being given by the Government of Alberta. Visitors must be vigilant for symptoms and must immediately self-isolate for 14 days. Frankly, from today onwards, all non-essential travel plans should be cancelled. And let me be clear about that. I still hear about people planning to take spring break outside of the country. If they do so, they may have difficulty getting back into Canada because of the cancellation of flights. And if they do come back, they will be required to self-isolate for 14 days. There is no good reason to be traveling for leisure purposes at this time. I have asked Travel Alberta, in fact, to redirect all of their advertising to informing Canadians who are, for example, snowbirds in overseas locations about the protocols for their return to Alberta to help us manage the COVID-19 response. I want to remind people that seniors and those with compromised immune systems are the ones with the highest risk. So just because you don't feel at risk yourself doesn't matter. We're all responsible for each other's health at this time. I am concerned by reports of inadequate screening and information for people arriving from international flights at our airports, and I will be raising those concerns directly with the Government of Canada. The Emergency Management Committee of Cabinet met earlier today. In response to the escalating number of infections, Dr. Hinshaw and her team have recommended new measures on social distancing to contain the spread of the virus, and the government has accepted those recommendations. These include the immediate cancellation of all K-12 and post-secondary classes, as well as closure of licensed childcare and out-of-school care programs in Alberta. More restrictions may be rolled out over coming days as officials' advice evolves in response to the identification of new cases, so please keep checking for the latest public health directives online at alberta.ca. And please continue to take all basic health precautions. Wash your hands thoroughly with soap for at least 20 seconds, do so regularly, and always before touching your face. Above all, take care not to expose the elderly or immunocompromised individuals if you have any symptoms of sickness. Minister LaGrange and Dr. Hinshaw will have more to say on the cancellation of classes and the closure of daycares. I am also announcing today that the Government of Alberta will increase the health budget by at least $500 million to cope with the COVID crisis. This is in addition to our already budgeted amount of $20.6 billion for Alberta Health, which is the highest amount in the province's history. This additional $500 million will be a recommendation of the government for an appropriation to the legislature this week. And we will continue to provide all of the resources necessary to help our public health officials cope with this crisis. Under the leadership of Deputy Minister Paul Winnick, the Provincial Operations Centre has moved to level 3 of emergency preparedness and has increased staff and resources accordingly. For those who don't know Paul, he is a former Lieutenant General, Commander of the Canadian Army, and Vice Chief of Defence Staff, who recently joined the Government of Alberta. We're fortunate to have somebody of his depth and experience at this time. In consultation with Paul and senior public health and safety experts, we are assessing all future actions that should be taken to protect Albertans. Once again, I want to assure Albertans that the Government of Alberta is totally focused on dealing with this crisis right across the board, all departments and agencies. And we are having excellent cooperation with municipal governments. Last night I chaired a teleconference together with Dr. Hinshaw and Health Deputy Minister Rosen with Indigenous leaders across the province, and we're impressed by their level of preparedness for the pandemic. We have full confidence in our public health and safety officials, and we're working together to do everything in our power to contain the outbreak and to keep Albertans safe and healthy. We are equally dedicated to managing the very serious economic consequences of the pandemic and the coincident global crash in energy prices. It is critical to keep businesses operating at this time wherever possible, for as long as it does not compromise, public health and maintain income support for workers. I'll have more to say about that in the legislature tomorrow. Decisions and actions taken now will ensure that our economy recovers as quickly as possible after the health crisis ends. We will move fast and we will move first, if necessary, to stop the spread of this virus and to keep Albertans safe. So now I'll ask Lieutenant General Winnick to speak about our emergency preparedness, and then Dr. Hinshaw will provide a full update on COVID-19 in Alberta and explain the rationale for cancelling classes and childcare facilities. And then Minister of Education LaGrange will provide further information about the balance of the school year. General Winnick.
Thank you, Premier. Good afternoon. I'm Paul Winnick, the Deputy Minister of Municipal Affairs. The Government of Alberta is taking COVID-19 very seriously, as the Premier mentioned, and we've been preparing our response since it was first identified in January. Since that time, we've been carrying out extensive cross-government coordinated efforts in order to remain fully prepared. Yesterday, our Provincial Operations Centre here in Edmonton elevated from Level 2 to Level 3 out of a possible 4 levels. Level 3 means that we are further enhancing and strengthening our cross-government coordination so that we can respond to rapidly changing situations. The Alberta Emergency Management Agency, which runs our Provincial Operations Centre, works with our partners to ensure that we can continue to respond to this ever-changing situation. Daily reports are distributed from the Provincial Operations Centre to all key partners, including federal departments, our own municipalities, and various other agencies across the province, to ensure that there is a common level of real-time situational awareness. We are constantly updating and reviewing our pandemic plan, as well as the Government of Alberta Business Continuity Plan, to ensure that measures are in place to maintain essential services to Albertans. As you are aware, Alberta has been through significant emergencies and disasters in recent years, including major fires and floods. Rest assured, because of these experiences, we are now able to work seamlessly with our key partners across the province and across ministries to respond to this evolving pandemic. Thank you.
Dr. Gina Hinshaw will now give an update on the current cases of COVID-19.
Thank you, and thank you all for coming. As the Premier noted, I have recommended that aggressive new public health measures be implemented across the province. Here in Alberta, we have confirmed 17 new cases of COVID-19 in the last 24 hours. This means that 56 cases have now been identified in our province. 2 of the individuals are receiving treatment in hospital and are in stable condition. The other 15 cases are self-isolating at home and are expected to make a full recovery. As always, health officials have taken swift action to isolate these individuals and any close contacts who might be at risk. However, there are several concerning elements about these new cases. Our investigation determined that 7 of these cases stem from a single gathering that took place in Calgary Zone. This underlines the fact that gatherings can accelerate spread of the virus. In addition, at least 2 of the cases within the last 2 days appear to have been acquired from an unknown source. This means we are likely seeing community transmission in Alberta. Community transmission is when a person catches the virus from someone who stayed in the province and not from someone who recently traveled. Until now, all cases in Alberta had been travel-related or close contact with a returning traveler. These two cases mean that there are other cases in the community that we have not identified, increasing the likelihood that Albertans may be exposed within their communities. In addition, another development over the past 2 days has been conversations that I have been invited to participate in with school leaders from across the province. I have heard clearly from them that the guidance provided by Health is proving extremely difficult to put into practice at the front lines due to product shortages, challenges with staffing, and other operational issues. I have repeatedly said that we will monitor the situation, assess the emerging evidence, and make decisions accordingly. Based on what we've seen over the last 2 days, it is clear to me that now is the time for additional action. We need to put in place more restrictions to help slow the virus and protect public health. That is why, effective immediately, the Emergency Management Cabinet Committee has approved my recommendation that students no longer attend classes in schools or post-secondary institutions until further notice. All regularly scheduled classes are cancelled, regardless of class size. We are also asking all licensed childcare facilities and out-of-school care programs to close immediately. Approved day homes are exempt due to the small number of children they care for, but they are encouraged to use sanitation practices and the guidance that we released late last week. As a parent with children in the school system and in after-school care programs, I recognize that this is extremely disruptive for many families and for those working in these sectors. This is not a decision that we are making lightly. I made this recommendation after extensive discussion with school boards and in consideration of the cases of community transmission that were identified over the weekend. To be clear, we are not closing schools. Teachers and other school staff should continue to come to their schools to plan potential alternatives for students, particularly those in grade 12. I ask parents to keep their children from gathering in large groups, as the purpose of this recommendation is to prevent the spread of the virus. I know that many parents, childcare workers, and teachers will have a lot of questions. This decision was made only a few hours ago, so many details are being confirmed. We will provide answers and make sure that Albertans get the information they need. Also effective today, we are recommending new restrictions for all long-term care facilities and continuing care facilities. I am advising that these facilities limit visits to only essential visitors at this time. Seniors and people with pre-existing health conditions are the most at risk from COVID-19. Special precautions must be taken to ensure that there is not virus spread amongst these groups. I know that families want to visit their loved ones. This step is not taken lightly, but is essential to protect the lives of the most vulnerable Albertans. I'm encouraging families and friends of those in these facilities to think of other ways besides visiting that they can support and encourage their loved ones through this difficult time. Finally, while last week I announced that places of worship were exempt from the restrictions on mass gatherings, that recommendation is changing. The exemption last week was done to try to minimize the impact of these restrictions on the daily lives of Albertans and in the context of having only travel-related cases in the province. However, as I mentioned earlier, that has changed, and we now have evidence that community transmission is occurring. Effective immediately, all places of worship are now being asked to follow the same restrictions being placed on other gatherings in the province. All mass gatherings of 250 people or more should be cancelled. Any event that has more than 50 attendees and expects to have international participants, critical infrastructure staff, seniors, or other high-risk populations in large numbers should also be cancelled. Events that do not meet these criteria can proceed as long as risk mitigation is in place, such as enforcing distance of 1 to 2 meters between attendees, ensuring that ill attendees are not present, and using sanitizer stations. Religious communities are a source of strength and comfort, especially in difficult times such as these. I encourage religious leaders to work with their faith communities to determine how they can continue to support each other, but in ways that reduce the risk of infection spreading. We all have a role to play in the days ahead. If you have loved ones or friends abroad, please connect with them to make them aware of the 14-day self-isolation period on their return. We have more information to help them plan at alberta.ca/COVID-19. I know this is a lot of information. These decisions are not made lightly, and I know they will have a tremendous impact on Albertans' lives, particularly parents, children, and seniors. I know some Albertans may wonder if these measures are truly necessary. I want to stress that they are necessary. It is crucial that we do everything possible to contain and limit the spread of COVID-19. The most effective way to do this is by taking a comprehensive, society-wide approach. Not testing alone, not contact tracing alone, not social distancing alone. All of them together. The experience of China, South Korea, Singapore, and others show that aggressive testing and contact tracing, combined with social distancing measures and community mobilization, can prevent infections and save lives. That is why we are taking these actions and why we will continue to closely monitor developments at home and around the world. AHS is not currently cancelling elective surgeries or other procedures, but they are preparing for any future steps that may be necessary. If additional steps are needed in the coming days, AHS will take them. The health of Albertans is and always has been our top priority. Thank you, and I will turn it over to Minister LaGrange.
Thank you, and good afternoon. I want to thank the many boards and education partners that have provided their views over the weekend. It has become clear that it would be challenging to implement health recommendations like social distancing and proper cleaning protocols. The safety of our students, teachers, and staff is the #1 priority for all of us, for me and for my cabinet colleagues, for Dr. Hinshaw, and for all school staff. As the Premier stated, we will be indefinitely cancelling classes across the province. Students are expected to stay home. We are all in this together, and everyone agrees this is the right decision. School authorities are expected to continue their regular day-to-day operations and ensure the safety of our school facilities. We expect maintenance, capital projects, cleaning of facilities, and administrative work to continue. Now, I know that student progression will be on the minds of both parents and students. We expect every student to receive a final mark and that students will progress to their next grade level next year. However, provincial assessments, such as provincial achievement tests, will be cancelled as of this time. Diploma exams, essential for post-secondary acceptance, will continue. We are confident that every student who is eligible to graduate from grade 12 this year will graduate. The government will also be working with post-secondary institutions to ensure that these extraordinary circumstances do not prevent our students from being eligible for admission to post-secondary studies for the upcoming school year. Teachers and other school staff will still be expected to work, either from home or at their workplace, to ensure these expectations are met. Decisions on how to do this are still to be made, and it may vary depending on the school jurisdiction. Given the unique situation, my department and I will work with school authorities throughout this process, and school authorities will receive their full allotment of funding for the 2019-2020 school year. I know these are challenging times for everyone. I will be sending out an open letter to parents in the coming days and will be working directly with school authorities to help parents through these changes. I would encourage anyone struggling as a result of this situation to reach out to mental health resources, such as Kids Help Phone at 1-800-668-6868 or the Mental Health Helpline at 1-877-303-2642. We are in unprecedented times, and we all have a role to play to keep our students and the staff that work in our schools safe and healthy. This is and will always be our #1 priority. Thank you.
All right, we'll now open it to questions. Just a reminder for those in the room, either come forward or speak up. Also, obviously, there's a lot of interest, so just one question and a follow-up, and please direct who you are asking the question to. Julia?
This will be for Dr. Hinshaw. Now that there are indications of community spread, what should the average Albertan, should they still be going out? Should they still go to restaurants and other things, or is it just limiting it to those essential things that they need to do in everyday life?
So I want to be clear that the recommendations that I've been making to Albertans for many weeks now about what that new normal is continue to be the things that I would recommend. First of all, and most importantly, if anyone is feeling ill, even if it's a relatively mild cold-like symptom or cough, they should not go out. If they have essential needs, they should get help from their family or friends to get their essential needs met. But we really want to emphasize that anyone who's sick should be staying at home. Secondly, if there are people who have chronic health conditions or seniors, they may wish to consider which events they want to attend. At this time, it would be wise for them to think if they're going to a gathering with many people, that may be something they want to reconsider. However, going to the grocery store, going to a restaurant, that wouldn't be considered to be higher risk necessarily. It would be more in settings where there are people, multiple people in close contact with each other. So again, the challenge always is that we want to make sure that Albertans take those precautions, washing their hands regularly, not touching their face with unwashed hands, covering coughs and sneezes. Ideally, if they're coughing and sneezing, they would be at home. And those are the things, again, that we want to emphasize over and over again. But the expectation has to be, this new normal has to be, that if people are feeling ill, they should stay home.
And would there be a threshold for, what we've seen in other cities, shutting down bars, restaurants, and other types of things? Do you foresee that coming down the line for us?
So the measures that we're taking are measures to prevent spread of the virus. As you mentioned, there are other places in the world that have taken more aggressive measures as they've seen spread of the virus in the community. Certainly, we'll consider the emerging evidence and making sure that we're keeping close eye on cases that are coming up in the next days to weeks to make those kinds of decisions if there are more aggressive social distancing measures we need to put in place. So these are conversations that my team is having about what's appropriate, and then as recommendations come forward, we have those discussions with the Emergency Management Cabinet Committee to make the best decisions for Albertans. And so again, these are things that are on the table for discussion should the situation continue to change.
CPC?
For either Dr. Hinshaw or Premier Kenny, are there any possibilities that the provincial borders could close given the jump in cases in terms of community spread? And obviously we saw that in Ontario today as well.
What did we see in Ontario? Just the number of cases increased. Yeah. At this point, the answer is no. The Public Emergency Act in Alberta does give the government extraordinary powers, if invoked, to limit border crossings. At this point, the normal law applies, where it's the Government of Canada, of course, that's responsible for the admission of foreign nationals to the country. And I've flagged, I do have concerns about what appears to be a lack of rigor with respect to screening and information being provided to people arriving on international flights in Canada, including here in Alberta. And I will be raising those concerns. I have a bit of a background in this as I served as the Federal Immigration Minister for 5 years. And it seems to me that additional direction and resources could be and should be provided to the Canada Border Services Agency. And I've asked our officials to explore whether the Government of Alberta could provide any supplementary resources to help inform folks arriving from abroad about what the protocols are for self-isolation. So that is a concern, but we are not at this point contemplating using those extraordinary statutory powers.
Question for the Premier as well, talking about traveling and limiting travel. For those that have to travel across the U.S. border for work, particularly truck drivers, are they required to self-isolate for 14 days after going there for work?
So I'll invite Dr. Hinshaw to provide a technical answer. This came to light when we indicated we wanted self-isolation for people arriving from abroad for 14 days, but I think it came very quickly to the attention of our public health officials that would potentially massively impair supply chains. We need those truckers bringing food supplies and groceries from south of the border to Canada. And we also need flight crews to be able to continue to operate as long as they are properly monitoring their health. So, Dr. Hinshaw, would you like to supplement that?
Thank you. Thank you. Yes, as the Premier has mentioned, we have made exemptions. So when we're considering critical infrastructure and critical services, I've spoken both with members from the airline industry, and I've worked with our transportation department and the industry of long-distance trucking to make sure that there are protocols in place to limit risk from those individuals working in those industries. There are certain things that need to be taken into account for their own occupational health and safety in terms of risks that they may encounter in their work. And then with respect to coming back into the province, again, I've worked with those industries to be satisfied that there are protocols that would make sure that those individuals are regularly monitoring their temperature, that they know what to do should they feel ill, and that there are plans in place if they're ill either abroad or in the country to make sure that they're taken care of and that spread doesn't happen to others. But as mentioned, we need to balance essential services with the need to prevent virus spread.
And his concerns, continue to rise if an Albertan knows someone who is traveling internationally who might not be following the protocol and self-isolating. Is there anything they can do? Is there a reporting system, anything that they can try to get them to isolate?
Yeah, that's a good question. And at the moment, given the volume of people coming in, we don't have the ability to write individual orders for each person coming in. I think what we are asking people to do is to remind each other, to remind the people who've just come back, what are the reasons that they maybe are feeling that they can't? Do they need some supports? Do they need someone to help them with essential services? Are they not aware that there is income support available to them for the self-isolation period? And so I think that if someone's noticing someone who just came back and who is going out and about, that they could make sure that they know what the recommendations are, make sure they know the supports that are available to them, such as income support, and again, remind them that this is something that we're all in together.
I'm just going to add to that. Doctor, as I understand it, Dr. Hinshaw informed us that one of the reasons for the change of recommendation on class closures was that there were some children who had recently returned from overseas with their parents who went into the schools notwithstanding the very clear recommendation not to do that. So it's very important that people through word of mouth spread the message that if you've been abroad recently, please self-isolate and very closely monitor your health, follow all of the recommendations. And normally at this time of year, tens of thousands of Albertans would be headed out of the province for spring vacation. And what we're asking those folks to do this year is to have a staycation. Please do not engage in unnecessary recreational travel outside of the province or the country at this time. In the next weeks, we also expect tens of thousands of Albertans who are snowbirds to come home from sun locations south of the border, and so they may not be following the Canadian news. So if you have, I say to the public, if you've got a mom or a dad or relatives who are down south who are coming home as snowbirds in the next few weeks, please make sure they know what the situation is here at home and that they self-isolate, they monitor their health condition very closely. And that's one of the reasons we'll be redirecting Travel Alberta's advertising budget to focus on snowbirds in the U.S. and perhaps elsewhere, letting them know we'll be working through the Canadian Snowbirds Association, but probably the most effective way of reaching them is through word of mouth.
We're going to go to the phone lines. We'll come back to the room. Operator, could you patch the first one through?
Thank you. Yes, the first question is from Chris Epp of CTV Calgary. Your line is open. Please go ahead.
Thank you. The question will be for Dr. There still seems to be a lot of ambiguity about groups of people. You reasserted that 250 or less is probably okay, but you're also saying small groups of kids shouldn't be together. We've got Edmonton closing down all their rec centers. Calgary not doing the same thing? I think a lot of people are wondering, what is this magic number we should be looking for?
Yes, that's an excellent question, and certainly the number is something that is on the table for discussion because we do know that even smaller groups than 250, if someone who is ill attends, there can be spread. So that's something we are discussing. With respect to children in particular, again, as you all know, I'm a parent of young children, so I do want to underline that it is challenging, even with the guidance that we provided and trying to have that zero tolerance for ill children in these kinds of settings, that we know that children often are in close contact with each other in ways that adults aren't typically. So we are focusing on children at this time today with these recommendations because this is a particularly high-risk group with respect to spreading virus. And then some of these other recommendations that we've made continue to be evaluated, and if we do need to change them, we will. Because again, the situation evolves rapidly day to day, and so we're making the best decisions we can at each given time and continually evaluating to determine if those recommendations need to be further changed and made more aggressive.
Operator, could you patch to the next question?
Yes, the next question is from Emma Graney of the Globe and Mail. Please go ahead.
Yeah, g'day. Thanks for taking my question. I just wanted to get some more details here. I'm not sure who wants to take this, but you were making the very clear distinction between classes being cancelled, but schools are not closed. I wanted to get some more details there and also double-check about exams, and that's post-secondary as well, diploma exams, what's cancelled and what is not. If you could shed some more light, please. Thank you.
Yes, thank you for the question. In terms of classes being cancelled, that means all classes are cancelled for all grade levels. And so we would be requiring that students stay home. No students are to attend school starting tomorrow. As far as the provincial achievement tests, the PATs, all of those will be cancelled for the rest of the remainder of this school year. The diploma exams, we will only be providing diploma exams that are essential for grade 12 graduates to be able to meet their post-secondary requirements. But again, this is fluid. As we've heard, we are in unprecedented times, and I will be discussing with Minister Nicolaitis, Minister of Advanced Education, on how we can move forward in this area.
Excellent. We'll take one more on the phone, and then we'll come back to the room. Operator, could you patch to the next question, please?
Thank you. Your next question is from Carly Robertson of City News. Your line is open.
Hi there. This is for Dr. Hinshaw. We've heard about community transmission now, and you said that there might be more cases out there. Do you have an estimation on what we could be seeing? We heard Ohio with a large number without proper testing. They don't really know. Is there an estimation of what we could be seeing, and is there an expanded ability for people to be tested even if they aren't a close contact now that we have community transmission?
So it's difficult to estimate exactly the number. Again, we simply have the two cases, so we don't know what the chain is from a case that was imported at some point and then how it got to these people. So it would be very difficult for me to speculate on the number, but what we can say is clearly those two individuals have acquired the virus from someone else, and we don't know who that is. So there's at least two other people, likely more, who had the virus, and we were not able to identify them. We are looking very closely at our surveillance and testing protocols. We did, just over a week ago, expand our testing to community testing in some settings in order to be able to detect these kinds of community transmission events. And so we'll be looking to see how we can further use our current lab capacity to both identify any returning travelers who may have the virus, as well as picking up community spread. So more details will be coming in the days ahead of exactly how we're going to be adjusting. But within our given lab capacity, we do want to make sure we're covering both returning travelers and people in Alberta. I will say, though, we simply do not have the capacity to test every Albertan with a cough. I do not anticipate that will change. And so you don't need a lab test to do the right thing. If you're sick, you need to stay home. And again, we will be working to expand our surveillance program, but people should not rely on a test result to take the appropriate actions of limiting spread of virus to others.
Go back to the room, Julia, and then CBC.
This is for Minister LaGrange. So with classes being canceled indefinitely for students, there may be some concern about how they will be able to keep up once they move on to the next grade level. So are there options for online classes, or what other options may there be?
We will have everything on the table. I'll be working closely with school boards and school divisions to ensure that we have measures in place to address those very concerns. But at this time, it's early days yet. This is unprecedented. So, you know, we've never had a closure of all schools across the whole province at one time for something as that could be indefinite for the rest of the remainder of the school year, possibly. So early days yet, but more information to come as we move forward.
This is a question for, I believe, Premier Courts in Alberta have announced that they're all but shutting down. So far, only jury trials and traffic tickets have been affected in the province. What concerns do you have about that?
Well, that is a decision that the courts have taken to help to reduce, I guess, to increase social distancing and prevent by delaying jury trials. Presumably, they'll be restarting those trials when it is safe to do so. But the administration of justice continues, and I think this is a very important message. Our institutions must continue to function. I think that applies to this legislature, unless and until there is a public health imperative. So I think what they're doing sounds like a prudent decision to increase social distancing, but continue with non-jury trials. The vast majority of trials are non-jury trials. So people should not imagine for a moment that they can get away with unlimited speeding. The law continues to be the law. The law will continue to be enforced. The police continue to do their job, and the courts do as well.
This is for Dr. Hinshaw. I noticed that there are some drive-through locations that have opened for testing. Just tell me how you expect that to be ramping up testing, and again, are there concerns that there won't be enough tests for those who need them?
So our lab, I guess there's two pieces to that. One is the places that take the swabs. And so as you mentioned, there's different locations across the province that are using models that can be implemented in those locations. Some of those indeed are, I don't know if I would say drive through exactly, but they drive up and then can have someone come to the car and take the swab as another measure of limiting any potential spread. So those are some of the assessment centers that I've referenced before that can be accessed by calling 811. So that's the one kind of piece of work that Alberta Health Services has done, is to expand access to that testing. The other piece of testing, though, is the capacity of the lab to actually run those swabs through. We did see over the last week an emerging challenge with the swabs and some concern that there was a shortage not just here but across the country. But our lab is incredibly creative and hardworking, and they came up with an alternate mechanism and are using different swabs now, so that's no longer a challenge. But what we do need to recognize is that our lab buildings and the equipment to run those tests, that we only have so much capacity to do that. So as I mentioned before, we are working with the lab. They are working hard to try to expand that capacity, but that does take time. As you can imagine, there's global demand for these kinds of tests. And so at the moment, what we need to do is use the capacity that we currently have, which is sort of around 1,000 tests, maybe a little bit more a day, and use that capacity in the best way possible to get a sense of what's happening in the province. But in the near future, again, we will not be able to test every Albertan with a cough. That will not be possible. So we'll be looking at ways that we can get a sampling of the province without, again, being able to open it up to everyone. And again, I reiterate that you don't need a test to stay home if you're sick.
I'd just like to supplement that. I just want to compliment and thank our public health officials for their tremendous work, efficiency, and innovation in expanding the number of tests available in Alberta. We've been running about 1,000 a day the last few days. To put that in perspective, at least 3 days ago, Ontario was doing about 1,000 for a population 3.5 times larger than ours. And three or 4 days ago, the United States, I gather, had only completed about 18,000 tests when we were already up to 6,000 to 7,000. So I believe that Alberta has been operating at one of the highest incidents of COVID-19 testing per capita, certainly in North America and perhaps in the world. And that's great credit to our public health officials.
Running out of time, so one follow-up and then Lisa.
Sorry, Dr. Hinshaw.
Does the move to try to expand more testing, does that mean there could be delays for people who are waiting for those test results?
So when I talk about expanding testing, again, we're trying to enhance the lab capacity to get more machines on board. That will take several weeks to try to get that built up. But in terms of a wait time for test results, at the moment, I think the wait times, again, we typically can get back to people within about 4 days of when they have their test taken. Obviously, we prioritize the positive test results to be the very first things that we follow up on. Sometimes it takes a little longer to work through the list and get the negative tests back to people. But I don't anticipate that a change in our surveillance will change the wait times, because again, what we're trying to do is to think about a way of getting a representative sample across the province so that we understand better what's happening. And again, we do have that testing happening right now, and we have for over a week. We're just trying to think of ways to expand the number so that we can have a little bit more depth in our community testing. But that is how we detected these 2 cases, was through those community testing protocols. And we'll just be working to enhance them. I don't anticipate it will change wait times.
Final question to Lisa. Reminder, we are doing this again tomorrow at 3:30.
Just to go back to the issue of courtrooms, Mr. Premier, what would the threshold be for closing certain courtrooms? We're hearing a lot of concern that there are essentially big gatherings of people in these courtrooms. Is the Ministry of Justice looking at anything like teleconferencing or something to address that?
I don't know if they are. We'll certainly check into that. But essentially, we would follow the advice of Dr. Hinshaw and her team. They briefed the Cabinet Emergency Management Committee this afternoon about other prospective social distancing measures that the province may adopt as guidelines. We are not at that point with respect to our courts. We are mindful that there are certain facilities, including, for example, remand centers and prisons, where there's a large concentration of people, which may be more vulnerable to infection. And I know that our officials are closely monitoring that, and in some cases are looking at alternatives for housing people. But I don't. Would you like to complement that, Doctor, in any way?
I think, again, courtrooms would just be one of many examples of places that, so it wouldn't necessarily be specific to that, but where we're looking to see, are there other additional measures that we need to take to enhance social distancing? As I referenced in an earlier question, we continue to assess the situation and continue to bring recommendations forward to the Emergency Management Committee of Cabinet, because this is a rapidly evolving situation.
Friendly reminder, guys, we are doing this every day at 3:30. We can bring in other officials to help provide information, including someone from the Alberta Justice and Solicitor General. Thanks for coming.
Thank you.
And we will update you again.